Hi moms, my name is Liz and I'm a midwife, and in this video I want to show you exactly what happens internally during childbirth when you have a vaginal birth and exactly how this baby moves through the birth canal. So let's look at the position of the baby for childbirth. I have a very tiny little baby here that doesn't represent the newborn size, but it's purely because she fits nicely through the pelvis so that I can talk you through it. So this is the placenta. It is attached to mom's uterus. This is the baby in the bags. So let's pretend your waters have broken, and I'm going to take her out of the bag here so that I can actually show you how she's going to move through the birth canal. She's now inside, she's attached to mom here. And before I put her in the pelvis, I want you to take a look at the pelvis and the shapes. So this is when the baby is obviously descending into the pelvis in preparation for the birth and going into the birth canal. If you look at it, can you see this is an oval shape like this? Now, if I turn it around, and this is the bottom, so this is where baby comes out, can you see this opening? The oval is more like this and not like this anymore. And this is in the way. This is your sitting bone or your coccyx. So this baby has to navigate, and obviously this is a small baby, but a normal full-term baby, this is not an abnormally small pelvis, this is a very average pelvis. So these babies have a very tight space to move through, and they have to change and shift their bodies in order to get through here. So towards the end of pregnancy, this baby is going to start descending into the pelvis, and 99% of the babies are head first. If you go feet first, this is when you end up with a breech baby. I'm not touching on a breech delivery. I have more details in this video right here. When we do an internal examination, we can actually feel the way that the baby is facing if there's enough space through the cervix. If you're not dilated at all, it's really tough to feel. But if you started to dilate, you can actually feel, because a baby has two soft spots. We normally think about the one right here, which is quite big, but the one on the back is the one that we check. It's called fontanelles, and midwives, doctors, medical professionals, we use this fontanelle to determine how this baby is lying in the pelvis, because it is shaped like a triangle, and depending on how the triangle is lying, we can establish whether the baby is moving down, which way the baby is facing, how the baby is facing, if they are turning with the head flexed up or down. This is like our little compass inside. Now remember, I said that we have an oval shape here, and a baby's head is also oval. It's not exactly round. The only way that they will comfortably fit is going in with their head sideways because of the shape of the pelvis, like I've showed you before. So this is right on the beginning when they're moving down. From here, the uterus is contracting. When you get contraction, this is an important point. When you get contractions, you're not pushing the baby out from here. The uterus is contracting, and when the uterus contracts, it pulls the uterine muscles basically upwards, and it compresses here on the top, and this is pushing the baby down together with you pushing the baby down. But now she gets to the point when it gets to delivery, and here we are going to start seeing crowning when the baby is about to be born. That phase of the head starting to come out is called crowning, and this is what it looks like. The opening of the vagina is really thick when you are not giving birth. By the time that this baby is crowning, it stretches out and it can be thin like the skin between your thumb and your forefinger here. But we don't only have a head that needs to fit through the birth canal, the shoulders have to fit through. So when this baby starts crowning, they're about to be born. But now, because of the shape of the pelvis, they went in like this, and shoulders are automatically oval shaped. And now you can see their shoulders are going to get stuck. So their shoulders need to turn sideways. If I turn it like this, you can see that the shoulders are not going to fit. So the baby is going to have to turn their shoulders. But at the bottom, the baby won't be able to come out sideways as well because of this little coccyx here. And you can see these two bony structures here, which is the bottom of the pelvis. So when this baby goes into the pelvis, they need to turn their head in order to be born, and they need to turn their shoulders. So this baby is very stiff. So she's going to do this. You can see immediately when I turn the head, this baby is just pushing through as well. But the shoulders need to follow. So at this point, when the baby is crowning, the shoulders have also turned. This baby is very stiff. The shoulders have also turned to fit into the oval part of the pelvis. Now you are pushing, and this baby's head is coming out, and the majority of babies are looking down when they are born. You do have the occasional, we call them sunny side up sometimes, that they turn up, and that is basically when they went into the birth canal, instead of molding with the pelvis and looking down, they faced upwards, and it's a substantially more difficult delivery. It's more painful, it's quite harsh on the back. It's not impossible, but it is tougher if the baby decided to turn upwards. So now this baby starts to crown, mom's pushing, and we say slowly breathe. Sometimes at this point we can tell the mom to just puff or blow out air, like because the skin is so thin. If this happens really quickly, tearing is much more likely. If this happens really slowly, tearing is reduced. It's not a guarantee that it's not going to happen, but it's substantially reduced because the skin is elastic and it gets time to slowly open, and then slide over the baby's face as mom is pushing this head up. But now, babies are not born in one go. Sometimes they are, especially if they are smaller, they kind of just slip out because they fit much more easily through the birth canal. But this baby is going to be born facing down. You can see now her shoulders are stuck here. So she won't be able to get out unless she turns. So by the time her head is born, what is happening internally is her shoulders are also now turning to align with the pelvis outlet that is now this oval and not anymore this oval, if that makes sense. So you can see now my baby is like this. So once the head is born, we always allow a couple of seconds for this baby, it's called restitution, to just adjust themselves, and they will automatically turn their head because this is not a very comfortable position. So if you leave a baby, you can be hands off, they will automatically turn their head back to the side their shoulders are facing. The reason this is important and why we don't force the head is because we don't know which side their shoulders are facing. So if this baby is looking downwards, I'm not going to force this baby into any direction, because what if I force her backwards? So I give her a moment, and we need her to turn her face because that makes delivery of the shoulders easier. She turns her head, and now you can see head and body is aligned. This is the symphysis pubis, the part right in front. This baby is obviously small, but the shoulders are normally a little bit tucked behind the symphysis pubis. And once the head is out and the baby's turned to the side, the midwife or the doctor will gently take the baby on both sides of the head. You will see we do this. And there you can see on the pelvis, when I pull down, maybe if I turn it this way, I do this. And when I pull down, I unhook that shoulder. But we have a little coccyx here at the bottom that is facing upwards. So I pull down and then I pull the baby up, and that's the moment where the rest of the baby is born. And now, for demonstration purposes, you can see the baby is still attached to the placenta. And that's the part that many people forget about. Once the baby is born, I think everything is done, but no, you still have the placenta to come out. At this point, if you do delayed cord clamping, the baby can go straight between the mom's legs and lie on her chest because the cord is normally long enough. I've got a video here that you can watch about delayed cord clamping and the benefits around that. If there is a need to cut the cord and separate the baby immediately, maybe the baby needs resuscitation, maybe there's other reasons for that, they will clamp the cord on two sides, cut it, the baby will go that side, and the mom still has a placenta that needs to come out. It can happen spontaneously that mom feels that the placenta is right in the vagina and she can push and it can come out. It's not nearly the size of a baby. It's not the same. It's squishy, mushy. It's basically like it's raw meat if you think about it that way. So normally after the baby's out, the mother will get an oxytocin or pitocin injection, which is synthetic oxytocin. It makes the uterus contract. We need the uterus to contract because what is left inside is a wound that the placenta leaves on the uterus this size. That is all going to bleed. So we need the placenta to come out. We need the uterus to contract because as the uterus contracts, all of those blood vessels get constricted and it minimizes bleeding. It doesn't stop the bleeding. You will still bleed. Remember, for weeks after the birth, you will still bleed regardless of a vaginal or a C-section birth. But now when the placenta is down, we as medical professionals, we will give a little tug on the umbilical cord to see if there's movement. If it feels really tight, it means the placenta is not yet detached. There are more severe cases where the placenta won't detach because it's grown into the uterus. but we're not touching on that right now. Once we can feel that if we pull on the cord, the placenta is also coming, you will feel that the doctor or the midwife places their hand on top of your tummy, right above your symphysis pubis, right there. The reason we do this is that if we pull on the umbilical cord, that we don't pull the placenta out, and it might still be attached to the uterus. It's just a safety precaution. So when I'm pushing down here, it might be a little bit uncomfortable, but it shouldn't be too sore. This is me making sure that the uterus can't come out. So if I pull here and nothing is coming, I know I need to stop. If I can feel something is coming, my hand is here. It's difficult with this pelvis here in the air. Let me see if I can pull it this way. So let me do it this way. My hand is here. We don't pull on the cord itself. There will be a clamp here. And we pull on the clamp to slowly see if this placenta is coming. And you can see this is the way, and this is pretty much how it will come out. Pull, pull, pull. Mom can give a little bit of a push. Normally she doesn't need to. And you will just feel that it's kind of something wet and bulky, but not hard like a bone, like a baby's head, slipping out, and the placenta is out. What happens after this is that we have to check that nothing of the placenta stays behind. So you will have two things that they check for once the placenta is out. A, they will rub on your uterus to make sure that it is contracted. We need to feel that it's contracted because there's a risk of postpartum hemorrhage if it is not, because of the wound that the placenta leaves inside. And a part of this is checking inside to see if we can expel any blood clots. Because of this open wound that is bleeding, you might start having clotting inside the uterus already before the blood even comes out. And when blood pools, it starts to clot. So it's not comfortable, but it is necessary to make sure inside this rubbing and this feeling expels any potential blood clots, because wherever there's a blood clot, the uterus can't contract. And the second thing is checking for tears. This is now where we are going to check when this baby was crowning. Was there any tears along the lines here by the vagina? Is it tearing to the side? Is it tearing downwards? Is it tearing inside? So you can actually inside the vagina also have some tearing. Those ones are much easier to stitch actually than any of the skin outside. If they do stitch outside, or if you had an episiotomy, and the reason I cut an episiotomy is not a standard procedure, it should never be. You have a right to refuse it. But in cases where it is indicated is when we can see the skin starts tearing, and the most likely place where you will tear, if there's a tear, is right down from the vagina to the anus. And we don't want that kind of tearing because then it can involve the sphincter of the anus if it's a big tear. So if we see that you are starting to tear, that's the point where while the baby is actually crowning, in between contractions, they can give an injection into the skin that numbs the skin and cut it to the side, not down, so that it might be a small little snip. Basically, the idea behind that is that if it's going to tear, it will follow the path of least resistance. So if there's already a little cut and the tear gets bigger, it will rather tear to the side, and you save the sphincter of the anus. That's the only reason why we cut an episiotomy. So afterwards, when we have to suture, we will inject the skin again. If there was no episiotomy and you still tore, there's a tiny, tiny little needle. It's basically a needle we use to inject babies with, that most people will use because obviously it's a really sensitive area. They inject it. It's a little stinging sensation when they inject it. And then when there's suturing happening, you shouldn't feel any pain. If anything is painful, please let the people know to give you something. It's not a matter of, oh no, it's just 2 or 3 stitches, just hold out, we will be done soon. You shouldn't have pain when they are suturing you. So there you have it. If you found this helpful, make sure that you tell your friend or your family members who are pregnant to also watch this video so they understand exactly how it works and how intricate the whole birth process works. And if you think about it this way, it's sometimes mind-blowing to think a baby can fit through such a tiny little space to be born. Thank you for watching. I hope you feel a little bit better prepared. And if you are ready to prepare a little bit more, have a look at this video right here.